Hi, I'm Lori Jean Ellis, and I'm here to talk to you about how breastfeeding success starts before birth. Here's what we're going to be talking about during this video. During this video, you will learn about communicating with all the right people before birth and at the hospital. You will see step-by-step guide to correct latch. You will learn about signs your baby may exhibit if he or she is hungry and how often to nurse. You will learn about signs that your baby is getting enough to eat, and lastly, we'll talk about common breastfeeding positions. Talk to your doctor about these things. Let your doctor know that you're planning to breastfeed and ask if the place where you plan to deliver your baby has the staff and setup to support breastfeeding after childbirth. Ask your doctor to recommend a lactation counselor. You can establish the relationship with a lactation counselor before your baby comes so you have support ready after the baby is born. Talk to your doctor about your health. Discuss any breast surgery or injury you might have had to your breast. If you have depression, or if you're taking supplements or medicines, talk to your doctor about treatments that can work with breastfeeding. Lastly, ask your doctor about birth control options after delivery. Some types of birth control interfere with breastfeeding, but many do not. When you go into the hospital to deliver your baby, talk to the staff about these things. Tell your care team that you want skin to skin in the delivery room. Skin to skin is when the baby is unclothed and is placed upon your bare skin, either your chest or abdomen. There are many benefits to skin. It helps newborn babies stay warmer and calmer. It reduces crying and helps to maintain normal blood sugar levels. It helps start breastfeeding and promotes bonding. Tell your care team you want to breastfeed as soon as possible after delivery, ideally within the first hour of life. Sucking instinct is very strong within the baby's first hour of life. Early breastfeeding promotes breastfeeding success. Ask nursery staff not to give your baby a pacifier or a bottle with a nipple. Your new baby is learning to breastfeed. Offering artificial nipples can cause nipple confusion. Lastly, ask staff if your baby can room in with you while you're still at the hospital. Talk to friends who have breastfed successfully. They can be a wonderful resource for you. Consider taking a breastfeeding class. Pregnant women who learn about breastfeeding are more likely to breastfeed than those who don't. Breastfeeding classes offer pregnant women and their partners the chance to prepare and ask questions before the baby's arrival. You might be able to find a breastfeeding class offered at the hospital or WIC clinic or even at your doctor's office. Lastly, get the items you may need for breastfeeding prior to delivery, such as nursing bras, covers, nursing pillows, and maybe even a breast pump. Next, let's learn about the steps to achieving the correct latch. It's good to be exposed to this information prior to delivery. First, start with your baby turned toward your body, close to you with the nose to your nipple. Don't put pressure on the back of the baby's head. Step 2. Move the baby back an inch or two. Allow the head to tilt back. Watch for the baby's mouth to open wide. Step 3. When the mouth is open wide, bring the baby closer to you. Your nipple will be in the top half of the baby's mouth. Step 4. Your baby should be able to look up at you. This provides eye-to-eye contact between you and your baby and is the distance your baby can see the best. Step 5. Correctly positioned, the baby's chin is against the breast. The lips make a seal at the breast, and the nose is close to the breast. There is more of the dark areola showing near the nose than the chin. Although it might look longer, your nipple should be the same shape at the end of the nursing as at the beginning of the nursing. Breastfeeding should not hurt. A feeling of gentle tugging is okay. If it does hurt, place your finger in the corner of the baby's mouth breaking the seal and try again. Now we'll talk about feeding cues, or signs your baby may exhibit when he or she is hungry. Infants become more alert and active when they're hungry, putting hands and fists into their mouth, making soft sounds, or sucking motions with their mouth. They'll turn their heads toward the breast or just turn their heads and open their mouth. Crying is a late sign of hunger. It is harder for a baby to latch when he or she is upset. It is important to watch for early feeding cues to prevent this from happening. Over time, you will be able to learn your baby's cues for when to start feeding. So, how often should you nurse your baby? It is best practice to feed your infant on demand. That is, feed your baby when he or she acts hungry. Let the baby set the schedule. Breastfed infants typically nurse 8 to 12 times or more in a 24-hour period. Very young breastfed babies do not eat on a schedule. It's okay for an infant to eat every 1 to 3 hours for several hours. Breast milk digests easier than formula, so breastfed infants eat more frequently than a bottle-fed infant. Many new moms are curious about how much milk their new baby needs. On day 1, the infant's stomach can hold 1 to 2 teaspoons per feeding. By day 3, the stomach capacity has increased to 0.75 to 1 ounce, and by day 7, the stomach can hold 1.5 up to 2 ounces. Here is a question that all new breastfeeding moms ask. Is my baby getting enough to eat? There are definite signs that show that a breastfed baby is getting what they need. By the end of day 4, an infant should be wetting 6 times a day and having 4 stools. Newborns who are getting enough to eat will begin to gain weight by day 5 or 6. Breastfed infants should start gaining an ounce per day starting day 7. Another sign they're getting enough is the newborn should produce breastfed stools by day 4 or 5. Let me show you what a breastfed stool looks like. Newborn stools are dark, thick, sticky, and tarry. Day 2, the stool starts to change. By day 3, it's starting to take on a greenish color. By day 4 to 5, it becomes the typical breastfed stool, which is a liquidy, seedy, yellow stool. This brings us to the last topic of this video. We are going to review common breastfeeding positions. The laid-back breastfeeding position is often mom's first try in the delivery room. The baby is placed on mom's chest or tummy soon after they are born. The infant instinctively works their way towards one of the breasts and attempts to latch. This is known as the breast crawl. The cradle hold involves mom sitting upright with baby positioned on its side, head and neck lying along mom's forearm, and its body against her stomach in a tummy to mommy position. Although it's a very popular position, it's not always easy with a newborn because it doesn't give the baby as much support as some of the other holds. The cross crawl looks similar to the cradle, but mom's arms switch rolls so the baby's body lies along her opposite forearm. The aim is to support the baby around the neck and shoulders to allow them to tilt their head prior to latch. This is a great newborn breastfeeding position and is also good for small babies and those with latching difficulties because the baby is fully supported on mom's opposite arm and she has more control over the baby's positioning. With the football hold, mom sits with baby resting on her forearm. Baby's body is tucked along mom's side with their feet towards the back of the chair or whatever mom is sitting on. This is another helpful early nursing position because it supports the baby well while giving mom plenty of control and a good view of their face. Being tucked in closely along mom's body will help baby feel safe. The side-lying position is ideal for relaxed night feedings and breastfeeding in bed or on the sofa. Mom and baby need to lie on their sides next to one another, belly to belly. This concludes our video, Breastfeeding Success Starts Before Birth. It has been a joy and a pleasure to be able to share this information with you.